Today I will present you our patient, a 17-year-old boy who came to us after head trauma and with a totally deaf right ear. At the same time, he had all clinical signs of vestibular loss at the same side. And we confirmed that with a vestibular test. Regarding completely lost function on the right ear and etiology, we assume on temporal bone fracture, but CT didn't show any fracture. But look the good ear. The good ear shows us the middle conductive hearing loss, but normal middle ear function. After that, we perform VAMPs, C-VAMP, and we got a response on the left ear, but also we got a pathological threshold and for vestibular cervical reflex on the left side. So it confirmed that conductive hearing loss actually pseudoconductive and that means cochlear. And detailed CT scan show us that is a enlarged vestibular aqueduct on the both temporal bones. And what you would recommend to 17-year-old boy with totally deaf right ear and the underlying enlarged vestibular aqueduct on the both sides as a cause?
To prevent from head injury.
Good.
And anyone else have a recommendation? Does anyone recommend corticosteroid therapy? No? And hyperbaric oxygen therapy? Cochlear implant? Yes? Which ear? Right ear? Right ear, are you sure? Because he have a large vestibular aqueduct at both sides. Okay. Laser? Anyone? This is look hearing 4 months later, and who say cochlear implant on the right ear? No, you didn't say that. Okay, and how we can explain the returning of hearing? And this boy received the corticosteroid therapy without any improvement in hearing. After he got to hyperbaric oxygen therapy, and he reported us about returning hearing, but we didn't document it. And after that, the hearing deteriorated again. But later, he received laser therapy, and this is result. And we don't, because this is result because of laser therapy or spontaneous. We don't know that.
Large
aqueduct, vestibular aqueduct, there is ductus and sulcus and lymphaticus, and it can have the picture of many disease like hydrops. Maybe by the trauma, it had been the commotion of the labyrinth of the inner ear, and after that, it was spontaneously. Maybe something, oxygenation, maybe in a little part it had improved in some degree. But I don't believe so much. Maybe corticosteroid also can do something, because I think that it is maybe the picture of the hydrops, because it is if it is dilated congenitally, dilated aqueductus, then it can be like the hydrops, picture of the hydrops.
Thank you.
Theory, yes.
Yeah, we have the theory. And the vamp is very useful to in diagnostic of pathological and pathological pseudoconductive hearing loss. And the third video theory explains us the conductive component of this cochlear hearing loss. And but the main issue is that we don't know the mechanism of hearing loss in EVAS syndrome. And we know that inner ear malformation is because the genetic mutation, and we also know that EVAS is just a radiological mark of this anomaly and is not proportional to the hearing loss. And we assume that some pathological mechanism regarding the mechanism of endolympha and acidification of scala media is probably responsible for responsible for hearing loss in this syndrome. And we also don't know how the head trauma can deteriorate the hearing. And for this patient, unfortunately, the patient with enlarged vestibular aqueduct, the only therapy is consulting about avoid head trauma.